Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
The advantage of walnuts and soybeans and the canola oil and the soybean oil. So anyway, those are two aspects of our health that we may not talk enough about, the seafood and the water exercise. Any comments on those aspects?
Yes, I can comment on both of those. The water exercise is pretty amazing. It's almost counterintuitive. Uh, when I'm swimming, I see the ladies down at the mostly ladies down at the other end doing their aerobics, water aerobics. And I've tried it. It is awesome. uh, it's a workout and it's up tempo. They had the music going on, and you know, and I tried it. I tried it on my honeymoon for the first time, and I was sweating. I mean, it's a workout. I've also noticed that I had like bursitic pain in both of my shoulders before, but being in the water and swimming now, I don't have any more pain in my shoulders, both of them. But I swim regularly. I do over a mile 3 times a week as far as swimming goes. And my seafood diet is pretty like you just mentioned, uh, oysters, um, salmon weekly, rainbow trout are part of my regular diet as well. So I can vouch for those as well. Thanks.
Any other comments? If not, let's start with our articles. Got to leave at 10:30. I have an appointment at the bank. So, well, this is a good one to start with because this was also an article in the Post today, Monday, that is, about the fact that 70% of there's been a 70% increase in the number of deaths in adults over 65. This is, but the thing that was also surprising was that the white non-Hispanic adults had the highest rate of fall deaths, and black non-Hispanic adults had the lowest rate, which was interesting to find something that we were low in. But the fact that the rates of unintentional fall deaths are increasing is disturbing. And of course, we know that the older you get, the falls are the leading cause of death as you age. And so, what can be done about it? That's the question. We have to try to make it safe for people who are older than 65.
Dr. Callender, I think the falling too is in older people. I think maybe the onset of dementia as we get older too. Sometimes people don't realize that falling is a risk. My dad, who turned 102 yesterday, is living independently with a walker in his own house. And after his wife died last year, I said to him, Dad, I just don't know if this is a good idea. And he said, well, why? I'm fine. I'm fine. He really put up a lot of resistance. And I said to him, Dad, one fall and you're in a nursing home. And I said, I'm not saying that to scare you, but that's just reality. And he said, I know. And so for a year now, a year and a couple months since she died, he's been living alone, and knock on wood, there's been no falls. And he moves very carefully and conscientiously. And I think that's part of that's due to he's with it. He doesn't have any dementia going on, and he doesn't rush when he moves. And he is very cognizant of everything that he has to navigate. But it
Well,
still worries me.
the other part of it is that he's in a familiar setting.
Yes,
And when you put people in unfamiliar settings, that's when accidents happen.
that's a very good point. Yep.
Any other comments? Okay, well, this is a very interesting topic, and since it affects all of us, I think it's good to know that. And I think her point about the association with Alzheimer's is a good one uh, for all of us to know. Uh,
Um, Dr.
yes,
Callender, do have a comment. I am 74, will be 75 next year, and I did have two falls earlier. Well, one last year, late last year, one earlier this year. And it was a result of dizziness and lightheadedness. Now, one of the surprising things that I found out that was contributing to my fall was that I had a virus in my inner ear that had caused my balance to be off. And I had lots of tests and screenings done before they came to this reality. But luckily, I was able to take some therapy sessions, and my ear balance is back in sync, and I don't have the lightheadedness and dizziness that I did have. I'm saying this is just that we need to be aware of our conditions and how we move about, because my first fall was in Walmart and I just went completely down. And the heat had a lot to do with it. But when you feel something is going on with you, stop a minute, talk with your doctors, find out how critical it is and what can be done to correct it.
thank you for sharing. Any other comments from out there that relative to the fact that those of us over 65 are more likely to fall and having falls that result in severe damage and is the leading cause of death in people over 65. Okay, all right.
I wonder, does gravity have anything to do with it?
Gravity, what do you mean? Gravity is operational for everyone.
Exactly. So as you age, your fight against gravity increases.
Okay, any other comments? Okay, if there are no other comments, let's go to the next article. This is something that people like not to see too much about the fact that alcohol is linked to increased risk of pancreatic cancer, but actually alcohol is linked to increased risk of cancer in general, not only pancreatic cancer, but all cancer. And so you can see the first item is 36% increase in cancer risk for men consuming over 60 grams daily. And for women who drink 1 or 2 drinks, 12% higher pancreatic cancer risk. And of course, pancreatic cancer is probably one of the most difficult to treat cancers that we have, and is not just as associated with probably about a 30% risk of 30% likelihood of surviving over 5 years. So that means it's a very deadly cancer because you make the diagnosis late, and often it's untreatable when you make the diagnosis. And so the association between cancer and pancreatic cancer and alcohol is enough for us to be aware of it. And we know that uh, tobacco is number one, but alcohol is closing the ranks. Any any comments?
I had a question, Doc. Are there any symptoms of pancreatic cancer that you could tell me?
Often they're very late. Sometimes pancreatic cancer is associated with back pain. Sometimes it's associated with jaundice, where your eyes turn yellow. And sometimes, uh, probably the commonest association is pain of any kind in the abdomen, which should make you think about it. Any other questions or comments about it? Making the diagnosis of pancreatic cancer is also not that easy because the pancreas is deeply embedded in the almost retroperitoneal area, and it's therefore by the time you get symptoms, it's often too late. So an early diagnosis of pancreatic cancer, of course, is more likely to be associated with recovery. Okay, no other comments about this. Let's go to the next article. It's interesting. This is an article. We're getting more articles that are talking about the impact of alcohol and the negative aspects of alcohol are many, and you sometimes wonder why we've made alcoholic drinking so easy. But I guess the love of money is the root of all evil, and it has something to do with that. But you can see this: a person who drinks 35 alcoholic beverages a week could shorten their life by 2 years. And then the numbers go up if you drink more. So that some believe that moderate drinking is okay, and we've had a number of articles that have suggested that drinking a little is good for you. There are many who feel that that is not the case, that you should avoid alcohol always. But any comments on this subject, which almost everybody has an opinion about? But most of the data is now confirming that alcohol has a great association with cancers. Any comments about it, about alcohol and cancer, or alcohol and health? Okay. I guess none of us drink in this group, I guess. So, well, let's go to the next article then. These are 5 surprising stats on alcohol use disorder that very timely because we're now having more commercials. I mean, I was disturbed with the most recent commercial where at a wedding they were giving beer to all of the people in the audience as well as to the people who are getting married. I thought that was going a bit too far for me. But anyway, it now gets to the stage where commercials on alcohol are increasing, and 1 in 10 Americans struggle with alcohol use disorder. I'm surprised that it's that low, but that 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 means that if they take one drink, they have to take 2 and 3 and more, and so that's one of the important things. And people who are depressed more likely to drink to get over their depression, which is a mistake because it just worsens the depression. And then binging with adults with mental conditions binge more than others. And there is an association of genetic variants that are linked to addiction risk, which means that once these people drink, they get one drink, they have to get more. That's not good. And most people with this problem of alcoholism don't get the treatment they need. And so as a consequence, we get all kinds of conditions like liver disease and other illnesses that cause them to die because they don't get treatment for their alcoholism. Another disease that comes into mind is gambling. You know, alcoholism and gambling, two pretty tough situations. Of course, we don't hear a lot about gambling, but that's because we're legalizing it and we're trying to have more gambling with all athletic events, and that's a tragedy because it underestimates the malignant aspect of gambling just as well as alcoholism. Any comments or questions about alcohol, the alcohol addictions, and those kinds of things?
This is Charles Davis again. I know I said this was up before, and I spoke again from experience from the military side, and unfortunately, I say it's really has been the open door, the doorway, the path through for so many young people to, and now with the female component increasing within the military and the liberalism of the freedom of alcohol. They've tried to cut it back a little bit during the Vietnam era. They dropped the age real literally. If you were in the military, there was no minimum age. It was just there. But from some of the results of the negative side of it, they tried to move the age back up to basically what the states is trying to say, get it out of the teens and put it at 21. But still with the availability, the way it's so available, and nobody pays any attention. I mean, that's a broad brush of a statement to say pay attention to the 21, but they're trying to do that. But the activities as such, it's there, and it can lead a lot of people, many, as they come out, you still the idea that you can drink, but we know the end result of what it's doing to our society. But yeah, I still think that a lot of work could be done with the military on this.
Thank you for sharing. Any other comments?
Hi, this is Carol Tatum. I'm with John. Have they thought about the fraternities, particular fraternities, and not so much sororities, as when they do the binge drinking or when they're pledging and drinking?
What is your question? I didn't understand the question.
Have they thought about it? Society. I know at one time, every once in a while, a young person dies from pledging of drinking, binge drinking, and
Binge
emphasize
drinking.
that this is a poisoning.
Mm.
Um, has anybody, have there been any studies or anybody groups to really stop this among fraternities? I don't know so much as sororities, but I do know about fraternities.
Mm.
I don't know of any study. Of course, most of the campuses have banned groups that have deaths from those situations, but that's just the tip of the iceberg. And so I don't know anyone who's done any studies on that, but it's fair game, though. I think your concern is a legitimate one. But I think most of the fraternities now, because a lot of them have been kicked off campuses because of that. And as a consequence, I mean, they certainly have changed their behavior to some extent, so that pledging is not as horrendous as it used to be.
Mhm.
But I haven't seen any studies on that, though.
This is interesting. Miss Tatum's comment there, being a part of one organization that has had the experience, but you're saying that they get kicked off, but it's reactionary. But what is done, prior to what is being done prior to? I was just near campus just a little bit ago, and I could see the experience of the groups, loading it down, and the bed of a pickup loaded with ice and beer, and the whole team's just there. But, I mean, until the negative accident comes, uh, then you're kicked off. But what's being done, and Miss Tatum, I think she has a good point there. There's something prior to get us to take a look at it prior to.
Very good points, because the fact that it's reactionary means that there's nothing being done to prevent it. An ounce of prevention is worth a pound of cure. So that's where the action needs to be done. But I haven't seen any. Any other comments? Dr. Perez?
To that note, I would have to say that especially the Divine Nine, which are the Black sororities and fraternities, they collectively have spoken against that as hazing. And so all of the college chapters are warned against that. And I know they participated, the Divine Nine, in programs associated with the Center for Substance Abuse Prevention on that issue. So if you're looking for sororities and fraternities that have collectively taken that step, it would be the Black ones, the Divine Nine. And they should be commended for that. We should support them.
Thank you for your comments. Any additional comments?
Yes, I have a comment. I think, speaking of the military, you know, people who leave the military with PSTT have sometimes revert to alcoholism. And that's another tragedy.
Yeah. Okay.
That's what we call self-medication. And that's why we need to have access to health care for everybody. Universal health care. I can't say totally eliminate the problem, but we know that the research is there. We know that for alcohol, for marijuana, for any other drug, if people had access to quality mental health services, health care, it wouldn't be so much of an issue.
So I have a comment on this as well. And good morning, everyone. I feel like we're turning into a conversation with morality after a certain point, because we're talking about dealing with people's vices. And healthcare is one thing, it's an important thing. But I think studies have shown that you could tell people, you can give people knowledge all day, but if they don't deal with their morality, whether individual or collective, you're still dealing with a larger problem. A case in point is, the prohibition, last century. We tried to get rid of all alcohol use and all that carrying on, but it's still became just a problem. So I think it becomes just a humanity for us, religious folks. It becomes a sin problem, and that's a much bigger conversation, and strategy and prevention and being proactive that we need to have. But health is, it's a good first start, to talk about the health effects and the consequences. But I think we see that information and knowledge is not enough to completely get rid of the vices of human beings.
Yeah, it's interesting that Lucille Perez raised her hand again. It's interesting to see that we have taken our hands off of nicotine and alcoholism, and both of those are notorious killers. Dr. Perez?
I just want to say that for addictive disease, morality isn't an issue. I don't patients that I've taken care of with asthma or diabetes, or I don't question their morality as it relates to their illness. Yet addictive disease, where we know it's not a question of whether there's an addictive disease or not. Alcoholism is an addictive disease. And our community must be nurtured so that people who are suffering from it can come home and be cared for. Just as we have with cardiovascular disease, we have defibrillators. We make sure that people are aware of CPR. But yet we don't have that same thing as it relates to addictive disease. And so I'm just adding that. Their vices and moral things, I struggle with them all the time. But there is a distinction between sin and an addictive disease.
John Tatum?
Yes, I just wanted to add that self-discipline certainly plays a role in these addictive diseases. You have to have some self-discipline to stop some of these vices that people have. Cigarette smoking, alcohol, whatever the addiction is, you have to stop yourself, so to speak. You have to go to 12 steps. You have to put a patch on your arm to keep you from smoking. There are things that you have to do. Medical society can only do so much for you. When it comes to getting liver transplants or other organ transplants, they tell you that you have to stop alcohol and for a certain amount of time, sometimes it's 6 months before we will transplant you. And so who's going to do that? You are. Thank you.
Well, this is an interesting discussion that has two sides that will be unending because when you look at addictive diseases like alcoholism and gambling and all of the addictive diseases, self-discipline may have something to do with it. But if Dr. Perez's point is correct, then if you've got an addictive disease, then we need to step in and help you with it. Otherwise, the addictive disease will consume you. For example, people who are drug addicts, we have a situation where they can take medication for the rest of their lives. So I think Dr. Perez is suggesting that for addictive diseases, we need to have things like that available for all of those addictive diseases. But this is an interesting point of contention and discussion that will endure. Any other comments?
Yeah, I'm sorry. Real quick, lastly, and I do agree with Dr. Perez. And when I mentioned morality, I was only referring to not the addictive side of it, but to the behavior side of it, and particularly to what my mom was saying about what happens on college campuses. Um, there's the social behavior, where people they know the dangers, they've been warned of the dangers, they've been smacked on the wrist, but there's this still notion of, we're going to secretly do it anyway. We're going to, this is a rites of passage. There's a social behavior component that goes along with delving into vices, and that can begin where the addiction starts and such, where the chemical addiction starts. But I was speaking to the morality part where that's where it draws it to a larger problem where, how before people walk into it, how can we get them to stop it? I think that's more of a spiritual conversation or a religious conversation, as it pertains to getting into addiction eventually down the line. That's what I was speaking more to.
Thank you for sharing, John Buchanan.
Yes, you stated earlier that money is the root of all evil, and all those people that are making millions and billions of dollars off of people's addiction. And alcohol is a drug. I mean, it's a legal drug. That's all. Marijuana now in many places is a legal drug. And that's the way we need to look at it. People with the disease of addiction, I look at it like that. It's a disease that has to be treated, and it takes over all of the morality that could go along with it. Thanks.
Thank you for sharing. Tatum again. John Tatum again.
Hi, this is Carol. What I
Okay.
wanted to say is, Dr. Perez, the nine, um, unless it's changed, I don't think college kids have changed. Um, the adults are making these rules and saying that we will not accept this, but have the colleges start having adult supervision over youth. If you think about it, they're 18 to 22. And if you think about yourselves, how much sense did you? I know we all had sense, but I didn't. When you're on a college campus and you're getting ready to pledge, without that adult supervision, the adults are making these rules, but it's the youth that are guiding themselves and they make up their rules. And some of them might be fastidious and say, we're going to obey the rules. But when we were going through school, there was no adult supervision. It was youth supervising themselves about how they're going to take someone over. And unless they change and put adults over them, this will continue, whether they're black or white, fraternities and sororities, until they have someone that is chaperoning them and guiding them through the principles of how to pledge someone. And whether drinking stops or not, when you have a bunch of youth and you put their mindset together, they're going to continue unless something has happened to their mindset and they're saying, oh, we're going to obey the rules and not drink.
Any other comments? If not, we've had a copious discussion on this subject, which merits adequate discussion, and thank you for sharing. So we'll move to the next article, please. Now, this is a very cogent and important article that identifies that for the first time that about 3% of the people who gotten measles have had not been have been vaccinated, only 3%. And those that have been vaccinated seem to have a less of a problem with the measles. But the point is that if there's any question about whether or not you have been vaccinated, you need to have it done. Now, we still have MMR vaccines that are still available. And if you have any doubts about it, then you should be vaccinated. And this article talks about the fact that measles was eliminated completely, but now because of the fact that some people were not vaccinated, is raising its ugly head again. And so the goal is those who have not been vaccinated need to be vaccinated. And so this is important. Otherwise, measles, which is probably the most contagious virus that we know of, will become once again a concern.
Dr. Callender, I had a question. I had measles as a child. That was before the measles vaccine was available. I'm telling my age, but that's the way it was. But does that immunize me for life? I mean, what about people who did have measles many years ago as kids? Should we get revaccinated? I'm not sure if that would help or not. I mean, it's been unnecessary until recently. But now with the measles outbreak here in the United States, even it has me concerned.
It's a very good concern, and I think that one of the best things to do is to talk to your primary care doctor to address the issue of your vaccination. Because if you've gotten measles, which is one of the best ways of being
Mhm.
vaccinated in many ways, you would expect that you wouldn't require vaccination. But I think your infectious disease expert would be better to to address that. Those who've been vaccinated, it's clear that they do not require revaccination. But your question predates the vaccination. And so I'm afraid you need to ask your primary care doctor on infectious disease what to do about your particular case. Seems to me that since you've had measles, that's an excellent way of being prepared for the
I
future.
think there are a lot of us in that, anybody who was born in the 50s has probably been exposed and had measles.
Any other? This isn't. Yeah, this article identifies people who were fully vaccinated who actually got measles again, but they had mild cases.
Okay.
Any other comments or questions? Because this is something that all of us on this line are now addressing because of the fact that we had zero measles up until 2 years ago, and now it's affecting particularly those who are not vaccinated.
Well, the article does talk about birth before 1957, but with the outbreak of measles now, I'm just wondering if that's still valid.
Yeah, it's valid it is clearly valid if you've been vaccinated.
Yeah, okay.
The issue that you brought up is one that may be a little different, but to me, it's 97% effective. 3% is what you would expect, and those they had lesser cases. So, but it's a good idea to check with your primary care doctor or your infectious disease doctor to get specific information on that. Any other comment? Because this is a very timely issue. Dr. Perez?
One of the issues, you said talk to your primary care provider or infectious disease person. And unfortunately, now we also have to say talk to your politician because all of the studies that would begin to answer that question have been eliminated. And those experts who dedicated their life to this have been pushed out of the CDC, the epidemiologists. People who stayed in the government for its purity have now gone out into the private sector. So we have to turn this thing around. And around immunizations, the Secretary of Health and Human Services sends out lies about this. So I hope that when we talk to our politicians, we talk about being penny wise and dollar foolish. The impact of measles on a pregnant woman. I mean, just the deaths that we have eliminated, and now we're going to have false truths that are directing us. And our direction is not just in the United States, it has been global. So talk to your politicians. Vote.
Okay, John, thank you for sharing, Dr. Perez. John Tatum.
It's Carol Tatum again. That means if you're born in the 40s and up to 1957, which includes me, I got to get the measles shot too.
No. No, if you had the measles shot and you're fully vaccinated.
But I was born in the 40s. Was it available?
Wait a minute. Yeah, of course.
Yes. No, it was not in the.
Well, I got the measles vaccine.
You did.
I was born in 36.
I didn't get the measles, and I was born in 52.
You didn't get the measles shot?
No, I did not as a vaccine.
Dr. Callender, you probably got it because you were working over in Africa where there wasn't measles wasn't, there wasn't a
No
mass.
herd immunity.
Yeah.
No,
Yeah,
I had
exactly.
no,
Thank
I
you.
had to get it before I left the country.
Yeah, that's what I mean.
Yeah, okay.
Well, since I didn't leave the country, that means when I was born in the 40s, and I'm not telling you the year, but and my mother ritualistically, and I have to ask my brother. What I know we got every shot in the world because I was taken to the hospital once because I was petrified of shots, but that's another story. But how do you find the records? What shot you got? And or that means I got to go through this and get measles shot too. I'm
Well,
better
but
than
the
an
measles
adult.
shot is very benign. I
Uh,
mean, measles shot is relatively benign compared to what we get these days. But the MMR is a measles mumps vaccine, which is accessible. So if there's any doubt, you can get revaccinated. If you
is that
doubt
the
it,
one that left the scar on your arm growing
yeah,
up?
yeah.
Oh,
No,
I
I think the scar is smallpox.
No, the scar is smallpox. Yeah, that's the one. But you get it in the arm, yes. But the one that really scars you is the smallpox vaccine, not the measles vaccine. MMR doesn't do much in terms of leaving a scar.
so the majority of us on this session, we're going to have to get the shot, right?
I can't say anything about the majority. I just know that if you haven't gotten a measles, measles and mumps vaccine, you need to get it.
I'm reading online where the first measles vaccine was licensed for use in 1963 for the United States.
But if you had measles, you should have immunity. You
Yeah,
should
you
have,
should have it. Yeah.
yeah.
But again, talk to your politicians because this is the time that we should be studying it, especially because herd immunity was broken. We
Right.
have so many people you can get anywhere on the planet within 24 hours. So many things that were globally an issue are now a national issue, and all of our defenses are down.
But that does not say that you should not talk to your physician or your infectious disease expert. That just, in addition, you might talk to the politician. But if you want to get information on whether or not you in particular need to be vaccinated, you need to talk to your primary care doctor or your infectious disease expert.
Dr. Callender, is there a way to find out if you were vaccinated?
Yeah, because you theoretically, if you have a primary care doctor, they would know, or they should know. And if not, then you should get vaccinated. If there's no evidence of you ever having a mumps, measles vaccine, then you should be vaccinated.
But Dr. Callender, could you get a titer? Could you get a measles titer to see if you have antibody?
Yeah, I'm sure you could. Yeah, I'm sure you
Okay.
could. That's why you would talk to your infectious disease expert, and he would direct you accordingly if there was
Okay.
no evidence of you having received a vaccine. Well, in your case, you had the measles, so yeah. But in those situations where you didn't have the measles and you didn't have MMR, you would need to be considered for being revaccinated, which is MMR is very a vaccine that is uh, very available. It's not hard to find. So
What was that word again about measles? Whatever you do to find out if you had the measles shot? Measles titer or
A
something?
oh,
titer,
antibody titer. See
antibodies,
if you
yeah,
have
titer, right.
antibodies to measles, right?
Oh,
Because
okay.
if you had MMR, you would have antibodies to measles. But if you didn't have a vaccination and didn't have measles, then you would not have antibodies and you'd be susceptible to getting measles.
That R is rubella.
Yeah,
You never hear about that anymore.
MMR. Yeah, measles, mumps, rubella. They don't mention it because the disease was gone. It was included, but it wasn't thought necessary because it was gone. from the planet. Now it's back again. Okay, robust discussion. Good. Let's go to the next article then. Norovirus G2, number 17, has been responsible for 75% of the viral infections in the last year. This is remarkable, and when you know about the novovirus is that it's one of the viruses that alcohol doesn't kill, that you need to, soap and water will kill, but alcohol doesn't. So washing your hands becomes very critical, and not being in touch with people who have diarrhea of any sort, because that's one of the hallmarks of noroviruses, vomiting and diarrhea. And with this outbreak that we are talking about now, washing your hands is one of the key ways to prevent from getting it. Next, anybody who has had any diarrhea or vomiting, fever, chills, those are the signs of norovirus.
Dr. Callender, we didn't really hear about norovirus until they were talking about the cruise ships, right? That's where they showed up a lot.
Yeah, that's correct. Yeah. But it's with us now, so you have to be wary if you have any of those
Does
signs.
having norovirus, does that, because it is a virus, does that protect immunity if you have it? Can you get it again? Are there enough strains that you could get it again?
It sounds to me, yes.
Yeah.
Yeah, it sounds to me that you, especially since this is a different type strain of the virus.
Uh-huh.
Yeah, it would seem to me
Okay.
that that's the case.
Thank you.
Let's go to the next article then, please. This is the new variant of COVID that causes razor blade sore throats, which is different from the previous COVID variants. How much we're going to have to be dealing with that is not clear, but fever, chills, cough, and shortness of breath and loss of taste still persists. But the difference in this is that they have a razor blade throat, sore throat, that makes this different. And so as we look to whether or not we're going to get a new COVID 19 protection virus, this is one of the things that this variant would protect us against. Now, of course, the fact that COVID-19 are no longer recommended for healthy children and pregnant women has not been supported by obstetricians and gynecologists, because they still recommend it. But Kennedy, however, disagreed. So this is the point that Dr. Perez was making, that we have a new administration that has a different perspective on the importance of vaccinations. So by the time of the next meeting, we'll be discussing the new health advisors that Kennedy has appointed, and we'll see how they're going to move in terms of reconstituting the NIH and the CDC, which all have been drastically reduced. Let's go to the next article then. This is an article that says losing weight is likely to decrease your risk of chronic disease. especially if you're in your 40s or 50s. And so what they're just saying is that obesity is a disease that you need to uh, do away with. And the more you do away with it, the more likely you are to be healthy. In spite of the fact that most of the commercials now are emphasizing that those people who are weighty are okay. But as far as health issues are concerned, that does not seem to be the case. So losing weight and getting to a BMI of less than 30 is desirable. And it's interesting because uh, BMI less than 25 is considered the normal BMI. 25 to 30 is overweight. 30 and above is obese. And they looked upon midlife 40s to 50 as the critical window for intervention. So if you're older than 40, you should try to uh, have a BMI that's at least less than 30, but certainly preferably less than 25. And here you see that physical activity and poor diet are the most common reasons for being overweight. Minimizing white bread, fries, chips, chocolate, soda, and other things that you like are undesirable. Yeah. Any comments or questions? Darryl Armistead.
Yeah, the healthy weight range BMI is 18.5 to 24.9, and my BMI is 22.2, right in the middle.
Congratulations.
So be vegan and you can drop all that.
Okay. All right. Any other comments? Betty Blaylock.
Yes. Again, I'll good morning, everyone. Again, I'm going to refer back to the diet that you mentioned. Well, it wasn't really a diet, an eating habit, not eating after 4 o'clock, where that last statement about white bread and fries and chips. If you eat before 4 o'clock, they say you can eat anything. And so that's the path I took because it's hard to stop doing something you've been doing all your life. So, but it has afforded me losing weight. So I definitely have lost weight with that 4 o'clock stoppage. So if you don't want to stop eating your chips and drinking soda, just stop eating after 4 o'clock.
Anybody else want to share?
Yeah, I just want one joke. What do cows and bulls eat? They're vegetarian, and you want to be as big as a cow or a bull, just eat a lot of oats.
Anybody else want to share? Okay. All right, let's move on to the next one. This is interesting because I was just watching a program on Gandhi, and he used to have water only fasts. And many thought at that time that would decrease the inflammation. And but water only fasting, and according to this article, and they don't have an enormous, only 1,422 individuals. So it doesn't make this a gigantic study. Uh, Suggests that the water only fast didn't uh, give you the desired reduction of inflammation. Uh, Fasting is something that has been done, the 40-day fast of Jesus Christ in others. And of course, the Daniel fast are fasts that people have done from time immemorial. And one of the good things about fasting for whatever period you do, 40 is a long time. 40 days is a long time. But people who do fasting shorter periods of time find that it's very good for the GI system for short periods of time. And the GI system can use a rest. And so fasting intermittently is something that does seem to be helpful. So there's the intermittent fasting, and then there's the prolonged fasts of days and sometimes weeks. And the water alone fasting didn't really accomplish what they thought it would, and that fasting is fasting.
I think correct me if I'm wrong. I'm sorry to jump in. And good morning, family. I love you all and appreciate you. I think the intermittent fasting, and I'm asking you this as a question, Dr. Callender, is the fasting daily, cutting off eating early, and having greater than 16 hours of fasting versus fasting for 3, 5, 7 days. Is that I'm making that distinction.
Well, they are distinctively different. The intermittent fasting, and Betty used 4 o'clock. Actually, I use 6 o'clock. But that 18 hours of fasting is supposed to be very helpful, but it doesn't take the place of the other fasting because the other fasting is really more for praying and fasting and tarrying and those kind of things, which is purely spiritual meditation. And whereas the intermittent fasting is something that is done for just to stay healthy, whereas the prayer and fasting has a spiritual connotation that far exceeds that of the intermittent daily fast. Because in many ways, uh, it's hard to consider that fasting. I mean, because fasting, I would think, would be a 24-hour period of time at least as a minimum, and 24 to 72 hours would be. But the intermittent fasting is something that you do that is good to allow you to lose weight and get your BMI to where it ought to be. But I don't consider that the same as the praying and fasting that many do for spiritual reasons. Mark Tatum.
Yeah, just a quick comment that those religious communities that do in effect what is the intermittent fasting, from sun up to sundown. I think they've been getting that a good formula, or they have a good formula for that. And I certainly agree with your comment, Dr. Callender. It's beyond just fasting. I think part of the holistic, healthful process is the praying and fasting too. Not just turning down your plate, but turning down your plate and kind of focusing and meditating and those sorts of things. I think that all lends to good practice.
Any other comments? Okay, I thought we'd have more comments on that, but okay. Let's go to the next article then. Lights between sweetened drinks and dementia. This is a subject we've had a number of articles on recently. Remember the last one said that there was not But then there have been so many studies, it was not associated with dementia. And then you have studies that say it is associated with dementia. So the question is, who do you believe? And right now, the data is so mixed in between that it is clear that sugar sweetened drinks are not healthy. Uh, so I don't think there's much argument. We all know that sugar and salt are two of the modern day poisons that uh, lead to poor health.
Dr. Callender, I just read an article about our president drinks at least 20 Diet Cokes a day. No more needs to be said.
Oh, well, that's interesting. I didn't know that, but there's so many articles that show that Diet Cokes are not healthy. But well, anyway, this is another article that uh, doesn't give credence to the idea that sugar sweetened drinks cause dementia. There's so many other things that cause dementia, and we've talked about at least 10 to 15 preventable aspects of dementia, and cutting out sugar sweetened drinks is one of them. So okay, but anyway, this article goes with the back and forth about what's causing dementia and the argument that sweetened drinks are a cause of dementia, although there's still a lot of not a whole lot of data that supports this idea that this is the major cause of dementia. Let's go to the next article then.
Just another point on that previous.
Yes.
Sweetened drinks probably are not the major cause of dementia because I would think that heredity would be ahead of that.
Well, I think the evidence is that they have at least 40 to 50% of dementia is preventable by healthy diet and exercise and physical as well as mental and spiritual. So that there are other aspects of it. And I think that we've talked many times about the many types of exercises, mental, physical, and otherwise, that lead to good mental health and the avoidance of dementia. The problem is, of course, that yes, genetics is one of the components, but we know that that genetics is just one aspect of it, and it can be overcome by modifying your lifestyle. Any other comments about that dementia? Now, this is an interesting article that points out that the real risk to youth mental health is addictive screen time, not necessarily screen time alone. And it goes into a study of 4,000 children, and it identified that the real issue was when the child could not put down the screen, but was really addictive to the screen. And in those situations, the likelihood of suicide was surprisingly high. So that 2 to 3 times as likely if they found that the screen was addictive, they couldn't put it down. So that there's another addiction now, screen addiction, to add to the addictive causes. Mark?
So as a high school teacher and a father of teens, I see this just about every day. Screen addiction, not just screen use. And it is, I'm here to tell you, it's so prevalent. It's really, really scary. It, the main thing that parents can do, and potentially grandparents, we have control over this. We should be able to have control, because we're the ones paying for the cell phones. We're the ones that are still in charge, or should be, of our households. And we should have the controls for the Wi-Fi, for the phones themselves, because we're paying the bills for it. I see for parents, and let me include myself in this, it's just become a lazy thing where it's become a pacifier. We let them be on their screen because they're quiet, they're doing something. But as we see, this article saying, it contributes to poor mental health. I see it in the classroom as well. I'm trying to engage in a lesson, and especially the teen boys. The teen boys, more than I've seen the teen girls, they are so addictive to their video games, and they have these games where um, it's competitive video games, and they're doing it in groups. So in the middle of a lesson, they're competing and battling, and it's become so scary that but we need to do something about it. But we are the parents that start with, and I do my best to do it with my own kids, just to try to talk to them and try to engage in different activities beyond their cell phones. But yeah, this is a pandemic, especially for first and second world countries. And yeah, so I've seen this firsthand. I just kind of want to let you guys know that.
John Buchanan?
Actually, those children are copying their parents. If you've ever looked at a group of people on the street uh, at a traffic light, pedestrians ready to cross, 9 out of 10 of them are on their cell phone. So the kids are just copying what they see their parents do. And like Mark just said, I'm going to say a lot of parents use that phone or the tablet as a pacifier. I see kids, I mean, they will get an attitude if you take that pad away from them. They'll start crying and, yelling and screaming. They calm right down once they get on there and start, pressing their little buttons. So that's it. Thanks.
Okay. John Tatum?
I learned that the hard way. This week I have grandchildren and other children spending the night because of vacation Bible school. But I had my grandchildren, their parents must have done something to their phone that it automatically cuts off at a certain time of the night. And I didn't know that. And the other children, they could be on their phone all night. So at 3 o'clock in the morning, I saw one child on their phone and I tried to call my grandchildren. And it went straight into message. And I said, oh, so you can turn off their phones at a certain time. I guess I have to ask Mark that, but I didn't know that. But this tonight, when they spend the night, the ones that they're done turn off automatically, I'm collecting them so they can go to bed.
Betty Blaylock?
Yes, the comment about pacifier. I know of people who buy their kids the tablets or the phones as young as 2, 3. So instead of buying the pacifier that they put in their mouth, they give them that to keep them quiet. So it starts really with the parents, but the parents are addicted themselves, so they feel like the children might as well start and get wise to it too. But I agree, it is an epidemic. It's terrible. really is.
Okay. If there are
Dr.
no other comments,
Dr. Perez has her hand up.
Yeah.
Perez?
What can we do?
Yeah.
I'm a new grandmother. And it starts with me. I want to be an influencer in my grandson's life. So, I know I don't use my phone as much as his parents do, but how can I make an environment? What is lacking? Is it I know I used to go to church with pieces of loose leaf and crayons to give children in church
Yeah.
something to do. But my crayons and paper does not compete with the iPad. But what the teachers, the educators that are on this line, what can I do?
Can I dive into this answer first?
Go ahead.
In my opinion, it begins and ends with a good relationship with the child or the grandchild. A good a good interpersonal relationship where you could talk to them, they have your trust, you have their trust. And so that's developed personally and interpersonally, um, conversation after conversation. It's going to take us parents and grandparents to be, maybe slightly annoying. We're in their space. We're trying to have conversation with them often, and it may seem weird at first, but you got to kind of push through that awkwardness to establish a good connection and a good rapport with the child. Um, and that spans across all of life's distractions and things that they can get into. I personally use a strategy um for movies and TV watching. So even if you go back in the day, there's things that they shouldn't be watching on TV and that sort of thing, or things that seem to have adult or mature material. Like when you have a good connection, a good rapport with the child, you can talk to you. The best advice I've heard is that parents we're the filters to the world that they're experiencing. So say, okay, let's say, you watched a scary movie, that it was a horror movie and blood and killing and all that. And okay, so the child has seen it. Okay, let's talk about that movie. What do you think? Do you think that was realistic? Are you truly scared in real life? So like when you have those kinds of conversations, engaging their minds, you're becoming their filter. They're seeing how you process that information. You may have seen it, you may have not, but you're like, okay, this is what I think about that movie that you saw, or that video, or that music that you listen. These are my thoughts, my opinions. So when you're consistently engaging like that, then you become almost like that filter, that parent filter to their world that they're experiencing online, and they can make decisions accordingly. They know what their mom or dad feels. They know what their grandparents feel about this, and that's in the back of their mind versus not having the voice in their head at all. Because I think we know as parents, we instill the voices in our children's head. As they make decisions, as they come into crossroads. If we've been in their ear, our voices will be in their head, so to speak. So we need to continue those conversations, continue those. Um, Being a filter to them and establishing that rapport with them. Again, pushing past the awkwardness, pushing past the annoyances, and because it's important. They should not be experiencing the world, whether online or in real life, without the input and the filter of their parents and grandparents.
John Tatum was next.
No, I have nothing.
Oh,
Okay.
What I do, I agree with Mark, like even with the grandchildren. if you start engaging in conversations, and always be prepared because they're going to tell you something that you might want to fuss about, but um, you leave it alone and engage with them. Talk about it because they'll tell you some stuff that happens at their school or with their friends or what they think getting in trouble. Like last night we had dinner time. What does getting in trouble mean? Sometimes it's just talking too much, but to them, that's trouble. So be prepared to engage. Even when the children are around, they're so used to cell phone, you start engaging them in a conversation that they want to talk about, you'll get it and you'll get in their heads, and then you'll give examples for yourselves without that fussing part and telling them how it should be. Just talk to your children. And as Darryl said one time, the loudest ear, if you start talking to them, you can engage them. And even sometimes when they're over here playing and they remember and they told me, I said, okay, put the phones down, go outside and see how many leaves you can find, different leaves, and engage them. Dr. Perez, what you said, you can engage them. Church, don't expect children to sit up in church and do nothing. When we went to church, we went to sleep on our parents' lap because there's nothing for you to do. Children haven't changed. It's just our expectations. We expect them to stay awake during a boring sermon or something. Maybe they did. But now they got children's church where they're active the whole time and without cell phones. But children and adults, they want to engage, talk, and be talked back. So I agree with him very much. Talking, that's a gift that adults, I don't understand their dances, their lingo. I tell them, teach me what a certain slang word is or something like that. And they'll tell you.
Mhm.
Okay, thank you for sharing. Uh, let's go to the next article. Oh, Betty Blaylock. Yes.
Just a quick comment that I'm almost 81 and I still hear my mother's voice in my head. So what Mark said is true.
Okay, thank you for sharing. Uh, this is next article is about there are people who can't take statins, and statins are drugs that lower the cholesterol and the treatment for arteriosclerosis. So this is uh, a new drug that lowers the cholesterol for those people who can't take statins. And so it's good to know that there are other drugs that you can take because some people, when they take statins, they have muscular problems, they have other uh, side effects that make it impossible for them to take statins. So they do now have substitutes that you can take, and so it's important to know it, even though you won't remember the name. Know that there is such a thing, so that if you can't take a statin, there's another drug you can take that will lower your cholesterol as well. Any comments on that? If not, go to the next article. Depression, of course, has been something we talked about for some time, and anxiety and depression are the two commonest mental illnesses. And for the most part, depression has been difficult to treat and has been actually treated by uh, SSRI drugs that are have to be used for over a long period of time. And this is a new drug that has come out that one dose treats it. So um, this is important. And of course, one of the biggest problems with depression is that when people take medication for depression, they have side effects that are uncomfortable. And so they stop taking the medication and depression worsens. And so to have a drug that you can use that once a day, for example, is unheard of and is something that is new. And so it's hopeful that this will uh, bring in a new day in the treatment of depression, which still is one of the main causes of people committing suicide and uh, other activities that really are harmful to oneself. And as we know, the association of mental health issues with cardiovascular disease increases the mortality substantially. And so uh, this then to know that we have a drug that can be used to treat major depression is a very important contribution. So uh, this then becomes something that the primary care physician needs to be aware of, uh, that we do have drugs that now uh, can treat depression and don't take 3 to 4 weeks. Um, any comments on this change? Darryl?
Yeah, psilocybin, that's magic mushrooms, the hallucinogenic mushrooms that were very popular in the 60s and 70s.
Okay. John Buchanan.
Yeah, my comment is exactly what Darryl just said. It's a very powerful drug, very powerful, and on the order of LSD and mescaline, but it's very powerful. The impact is something that I'm questioning uh, as a cure for depression. I don't see it. I don't even know how these people, even started this study based on.
Well, it works. That's why they started the study, because you don't have a great treatment for depression. The treatment for depression right now often makes some people so different that they stop taking the medication. So they need to have a medication that they can take that treats the depression and doesn't make them vegetables.
My
I'll
It was
tell you.
very,
my point is that it's so powerful that it can cause other issues like schizophrenia, and if that's there, I'm doubtful about this, but anyway.
Well, time will tell. We'll see. Okay. John Tatum.
Yeah, the thing about psilocybin is that what dosage are you talking about? Because those people who used it in the 60s and the 70s that Darryl was talking about, they were most likely overdosing on that drug, you know? So when you are under the care of a doctor and you are a psychologist, and taking psilocybin, I think that they're going to give you the proper dose to help your situation.
Well, time will tell, and I think it's good to hear your points of view, because I agree with you that this is the beginning of the testing, and if the testing bears out, then fine, because depression is a tough disease to treat, and the SSRI drugs that we use now cause so many side effects that the patients won't take the medication. So if you got a medication that works and you learn how to use it, then the serotonin receptors are very important, but they they paralyze some of the patients and they just stop taking the medication. So if we can get a medication that they can take that works at a dosage that is not associated with those side effects, then it's worth studying. And so time will tell. We shall see. But it's food for thought, and it's good to hear the positive and negative sides of this discussion. Let's go to the next article then.
oh,
Yeah.
well, I support what John said about, what John Tatum said about dosage. That's really key. Yeah, back in the 60s and 70s, we did tend to overdose But as far as the three, acid, magic mushrooms, and mescaline, they are all happy drugs. You won't be depressed after taking them.
You may be something else, but not depressed. Okay. Betty Blaylock.
The old saying, anything in moderation. So if you're doing it in moderation, it might be helpful.
Okay, let's go to the next and will be the last article we take. This is sleep terrors. Nightmares is one thing, sleep terrors are another. This is their different definition of night terrors, characterized waking from sleep with intense distress. I've had my wife wake up like that a number of times, and uh, often they don't remember the dreams at all. But this is something that seems to be very benign. It occurs, and it's associated sometimes with. I mean, we had got to the point where I tried to wake up because she would scream so loud, and she would say that she doesn't scream. And I don't know if your partner. Of course, you have to have a partner to know whether or not you have this situation where you wake up others by your screaming, because you yourself probably wouldn't even remember it. But the thing is that it's relatively benign. It's not associated with other issues, and so it's not something that is going to be associated with mortality or serious morbidity. But these things do occur, and if you have a partner, you may know whether they wake up at night screaming or not, uh, because the person themselves probably wouldn't even remember. So it's just something that sleep terror that occurs. And I know we all, most of us have dreams, and most of us have nightmares, but we don't necessarily wake up screaming. So um, and this is a list of other things that can produce the same uh, sleep terror, as they call it. Just a matter of information. Dr. Perez.
Pediatricians deal with this all the time, and it's something that the parents, like a partner, notices it, and being able to allay the fears of the parents about what's happening to their children, usually makes parents think that their pediatrician is the sun, the moon, and the stars. So I always like getting that history.
Thank you for sharing. Okay. Well, this is our last article. So if there's any comment you want to make before we finish today?
Yeah, Charles Davis wanted to get his hand up. Did you?